Welcome back to Midday Kentucky, everyone. I was going to call it a different show altogether. We're back with our good friends at Georgetown Bariatrics and Advanced Surgical Services. Dr. Eric Smith is here with some of his patients, and we're talking all about their experiences. How are we coping? We all good?
Good.
Okay, well, let's talk to begin with, and we want to discuss Destiny. You started off at 311 pounds.
Yes.
Huge, my friend, with weight loss. Let's bring up the before and afters of you are now at 199. When you see these pictures now, hello, it's half the body.
Totally different person.
What do your friends say to you?
They're just amazed. This is a totally different transformation. It's been incredible.
Now, on your website, Dr. Eric, there are before and afters, okay? When you looked at the before and afters, did you think, this is going to be me? I can do this.
Yeah.
Did it give you that motivation?
I did find it
Because I know
motivating.
everyone at home, like when we talk about all types of before and afters here on the show, that's what people love to see.
Yeah.
They like to see the results. That's the key. I think one of the most important things that we need to talk about are health concerns, Dr. Eric, of being obese and overweight. Where are we at? Let's talk about you to begin with. What are your health concerns that you have now before your surgery?
I have sleep apnea.
Okay.
Difficult time breathing in the nighttime. And then the most painful is plantar fasciitis. It's horrible pain in my feet and ankles.
Okay, explain to everyone at home, Dr. Eric, sleep apnea and how that affects your life.
Well, obstructive sleep apnea is something that people battle with a lot if they battle with obesity. You may hear people using CPAP machines. You see the commercials all the time. People have to sleep with that. You know, your partner may think, gosh, they just snore a lot.
Yeah.
It affects how well you rest. You know, many patients find out they have it because they think, I'm falling asleep during the day, because they're waking up multiple times at night because they stop breathing.
Yeah.
But what a lot of people don't realize is the stress that it puts on your heart, the stress that it puts on your lungs. That it's not that you're just not resting well. It's very, very dangerous if it goes untreated.
Yeah.
85% of obstructive sleep apnea is cured with weight loss surgery.
Really?
So it's huge for patients. Not just the comfort of using a machine or sleeping well, but their life.
Kevin, now you were saying that you were pre-diabetic or you were diabetic?
I was diabetic.
Diabetic
Type 2.
Okay, and now this is before your operation.
Right.
And you were saying the minute you got off, you had the surgery, off
No
the
more
medication?
medicines, no.
How quickly after the surgery did this happen?
I quit taking all my medicines for diabetes as soon as the day that I had my surgery.
Is this this is the goal, to get you off your medications?
Yeah, and everybody's different. You know, some
Yeah.
people, if they've been on multiple medications for years, it may take them a little bit longer. But some patients come off immediately. I mean,
Yeah.
even though they've not made a huge change in their weight yet,
Yeah.
we're able to make those changes with the diet that they're having that's healthier, as well as the changes that have happened surgically too.
Destiny, what were your issues?
I had high blood pressure and sleep apnea. I also had battled depression, I think was related to my weight gain for many years.
When you hear each other's stories, what does that tell you?
It's motivating.
Yeah?
It's very motivating. That was the first time I felt at ease when we had our seminar and we were all in the same room together. It was the first time that I kind of took a breath and thought, I've got this.
Did your families have any concerns about you having the surgeries? And now they've seen the success, but you know, have any of your family said, we don't want you to do this? Or
No, not at all.
Really?
They've all been very, very supportive. My kids are even kind of part of the journey, and they're excited for me too.
Okay. What about you two?
Some of my family was, nervous and kind of withheld, about it, but afterwards they have just, seen how amazing it's been.
I think the most important thing is people sitting at home, they want to know, what is your advice? Do you know what I mean? Like, someone sitting at home, you're 10 months out, 6 months, about to have the surgery. Someone sitting at home watching you going, I'm still not sure. What's your advice?
Don't wait. That's my
Really?
advice. Just take the plunge. I mean, life's about taking the chance and taking the risk. I mean, there's a risk either way. If you keep being obese, there's fatality, in that.
Yeah.
I think something that's really important that I always try to share with patients when we do live seminar is when we kind of wrap things up, I say the worst thing that you can do is go into this feeling defeated. And a lot of people do. They walk into that process thinking, well, this is my last resort. I've failed on diets. I've failed doing all these things. I may have a family member in my ear saying, why are you taking the easy way out, or whatever, however it's interpreted.
Yeah.
And something that I think is important that I always share with the patients is, and it's a statistic that people don't know. If you take someone who's morbidly obese, okay, and you have them do diet and exercise alone, BMI of greater than 35, qualify for surgery, diet and exercise alone, I don't care if they go on The Biggest Loser, I don't care if they have a personal trainer, anything, their chances of losing enough weight to get out of that category and keep it off for more than a year is 1%.
Wow.
1%.
Crazy.
So who would choose a treatment that has a 1% success rate versus something that has a 65% success rate?
You're right. We're going to go to a break. We'll be right back. Back soon, everyone.